So our guest today is going to be talking about something that we talk about every single day here in the Edgemont online classroom and the Mill. We talk about how great it is that we are not as isolated as a lot of other people. We have each other and we talk about and we actually, because we see each other and we chit chat and we talk and we're in each other's virtual homes every single day. We're already being very proactive, but sometimes it gets to us being isolated and this darn pandemic. And a lot of people feel that they've lived. I know my dad was expressing these feelings yesterday. He's lived this long. He's 85, and he wanted to be, golfing with his friends in Florida next week. They're all getting together, and he's not getting on a plane, but his friends in Florida are all playing golf and having a reunion. Why can't I? And he's feeling really sorry for himself. Although getting him to play virtual poker with you yesterday was a real pick-me-up. So we do what we can do, but sometimes it gets the best of us and we need help. And it's one of the best things that you can do in times of anxiety, in times of feeling really, really, really low. It's great to reach out and get help. So our guest today is Dr. Victoria Tomasek. She is a Ph.D. and she's a licensed clinical psychologist. Did I get that right?
Yes.
She is here in the area. She's in, I believe, Verona, but she's everywhere because she is a virtual. She's doing teletherapy virtually. So she's going to do a presentation today on just that topic. So I will remove myself, and I will introduce Victoria. Thank you for coming.
Thank you. Good morning, everyone. Thank you for joining us today. I was so delighted when Michelle invited me to give a talk today about the mental health needs of seniors during COVID. I want to tell you a little bit about myself. Like Michelle indicated, I am licensed in the state of New Jersey as a clinical psychologist. I've had 28 years of working exclusively just with seniors in a variety of settings over my career. And those settings kind of include people who live independently in private homes in the community, independent living people in retirement communities, assisted living, long-term care, subacute units. I've worked in all those different settings over the last 28 years. And people call me Vicky or Victoria. A lot of the people that I work with call me Dr. Vicky. Right now, I'm on staff at Cedar Crest Retirement Community in Pompton Plains. But I'm just working remotely because my husband is significantly older than me and he has a lot of chronic conditions. So we decided until this virus settled down that I was going to be working remotely. So, this pandemic is a worry for all of us, but I think particularly for senior citizens, and there's a reason for that. And that's because we are, first of all, let me say that I am a senior citizen as well, all right? So I'm a senior citizen treating senior citizens. And you turn on the television, it's very typical to be quite alarmed at some of the statistics that they're talking about on the news, and particularly at how seniors are at greater risk. And that's particularly because we disproportionately experience greater adverse effects from the virus than younger people do. In fact, some statistics show that 80% of all COVID deaths are with senior citizens. So that certainly puts us at an increased risk, and a reason why we have to be so careful about this pandemic.
Victoria, do you want me to show the screen?
Sure. So there's other risk factors too that we're gonna, and in addition to like having a higher mortality rate as seniors, other things that put us at greater risk for COVID is we have a higher risk. Oh, that's the wrong one. Yep. Here we go. And the next one, Ben. So we're at a higher risk because we have existing conditions, comorbid diseases or chronic conditions that complicate our medical picture when we would get COVID. Another factor that puts seniors at greater risk is we would have a great disruption in our daily routines. And all the isolation resulted from COVID can mean we have reduced access to our primary and mental health care. And a lot of seniors have difficulty adjusting to new technologies, all right? And, you know, like Michelle mentioned when we first started this talk today, how fortunate all of you are in that you're tech savvy sufficiently enough that you can reach out and take part in these programs that are available to you. In addition to telemedicine, you know, you can take part in these classes that are offered through your senior center. But a lot of seniors are not tech savvy, and they suffer for that reason. So one of the biggest factors, of course, of the pandemic is the social isolation that results when we quarantine ourselves at home. And social isolation often leads to an exacerbation of any kind of mental health problems that you might already have. All right, so it's just a complicating factor. Another thing that puts us seniors at greater risk is that I think that we have a higher rate of bereavement with people that we know and have lost through the pandemic. And now with everything being turned on its ear, it's not easy to be able to even be with a loved one who is suffering from the illness. And I, just on a personal note, I lost my own sister in the last month from a COVID-related illness, and she was 3 years younger than I was, and in Pittsburgh, and I had to say my goodbyes to her via FaceTime and handle everything remotely, and it was very painful process. So I really, you know, feel for people who are having to deal with this during a time of social distancing. So all of these factors of being isolated and the disruptions in routine are a concern for seniors because there's a very strong connection between loneliness and isolation and the risk of premature death, dementia, stroke, depression, anxiety, substance abuse, and suicide. So, you know, if social isolation isn't treated, it could lead to all of these other things. And furthermore, these risk factors are higher for women. They're higher for Hispanics and people from low-income households. And certainly higher risk factors for people that are already in poor health and for seniors who live alone. So a recent study by the Kaiser Family Foundation reported that 46% of all seniors that they surveyed reported that COVID was impacting their mental health in a negative way. All right. 24% said that in a serious negative way, COVID was affecting their mental health with an increased level of depression or anxiety. Now, not all seniors are going to be affected in this way, though. There was a very important study that was done and published in the Journal of the American Medical Association recently that showed that many seniors, and most often people that did not have pre-existing mental health problems, many seniors have demonstrated a remarkable resilience to the virus, to the negative effects of the virus, meaning that they have a lower stress reactivity and better emotional regulation compared to, like, younger people who are dealing with this at the same time. They compare how seniors deal and how younger people deal, and they have concluded that in many cases, seniors are coping much better than younger people. And this might be due to another thing, a number of things. One is that seniors often have a greater even though we live on a fixed income, usually, we often have greater financial stability. We're not as affected by devastations in the job market like young people are when they lose their jobs. And typically seniors are often thought to have more compassion for other people and also a greater wisdom about life in general due to accumulated life experience. So all those things are on the positive end of being able to have more resilience about this disease. But with this study, we have to look at some of it with a little bit of caution because this study was done at the beginning of the pandemic. It's not clear what the long-term effects of COVID are going to be on people because it can be particularly hard when there's no real clear end in sight, that over time it can have a worse effect on people. And this study is looking at statistics, like what in general how do they react? And we're going to have individual differences across the board because seniors are a very diverse population. And we're going to have some seniors who do cope very well and some who do not. A couple of caveats with this study is they found, two things I think that really lead to better resilience in seniors. And that is if a senior citizen has one important, meaningful relationship in their life, whether it be a daughter, a son, a good friend down the hall, a social worker, whatever. Just even if you have one person that you can rely on and be in touch with on a regular basis on the telephone even, that can really mitigate the effects of social isolation. So it's not so much the quantity of people that you have in your life, but the quality. If you have that one person that you can call when you need to make that social connection, that's just a very important thing to have. And then the second caveat was that a lot of people who do show this resilience during the pandemic are people who do have some technical abilities and the capability to connect with others via telephone, via FaceTime on your smartphone, via Zoom on your computer. So the internet can be just a wealth of opportunities for people if you are a little bit tech savvy. Okay. So, but many people don't show that resilience and will be affected by the stress of being isolated from other people and from having your routine so rudely disrupted. And that may be people that have already had a history of some mental health problems in their life, or the stress of the pandemic could be such that it's causing people to have these symptoms for the first time in their lives as well. So, and some of these mental health problems that we're talking about include depression, anxiety, and people that have dementia. Sometimes the dementia will get worse during times of social isolation and an exacerbation of mental health problems. Post-traumatic stress disorder. A lot of people can develop physical problems of illness that are really psychological in nature rather than physical. But we're going to today talk in detail about depression and anxiety. So depression is characterized by a persistently depressed mood. and a loss of interest in activities that used to bring you a lot of pleasure. And this depression causes a significant impairment in your day-to-day life. All right. The intensity of these symptoms can vary from one person to another and can change over time. So I'm just going to review for you a lot of the different symptoms of depression. Number one is feelings of sadness, tearfulness, emptiness, hopelessness, apathy, and general discontent. Feelings of anxiety, agitation, restlessness, excessive worry. Oftentimes people don't realize that some of those symptoms of anxiety can really be part of a depressive disorder. It doesn't have to just be anxiety per se, but people who suffer from depression often have a lot of anxiety in their lives as well. Number three, irritability, angry outbursts, frustration over even small matters, things that in the past would not have pushed our button, but we're finding that now that you have no tolerance for even small frustrations. Number four, loss of interest or pleasure in most, if not all, normal activities. Inability to motivate yourself to engage in these activities. This is a very important one. And, you know, in addition to feeling sad or like not knowing what your purpose is, I think not being able to get pleasure out of your life and things that used to bring you pleasure is really one of the hallmarks of depression. Fatigue, number five, fatigue, lack of energy, so that you're tired all the time. So again, even the smallest thing might feel like you're too tired to do it. It might take too much energy. Number six, sleep disturbance, insomnia. Some people who are depressed can't sleep. Some people who are depressed want to sleep all the time. Some people are feeling restless during their sleep or wake up in the middle of the night and can't get back to sleep. Number seven, a change in appetite. And again, as with sleep, it can be one or the other. You can either lose your appetite when you're depressed, not feel like eating, or you could feel like eating all the time, like you want to eat for comfort. And either way, one results in weight loss and the other results in weight gain. Many people who are depressed feel that their thinking is slow, number eight, or that they're speaking more slowly, or that their body movements are slower. And you can really see that in people. Number nine, feelings of worthlessness or guilt, fixations on past failures or self-blame. Many people who are depressed kind of live in the past and can't let go of, you know, the trauma of something that happened to them in the past, or guilt over something that had happened in the past, and just can't get past the past and into the present. Number 10, trouble thinking, concentrating, difficulty making decisions, problems remembering things. This is definitely, you know, a symptom of depression as well. For instance, someone who likes to read a lot might find that as they're feeling more and more depressed, that they can't concentrate on a book, that they can't remember what they were reading, you know, to be able to keep up with the book and follow through. And that is a symptom of depression. Number 11, frequent and recurrent thoughts of death, suicidal thoughts or attempts. And certainly that is key. And, you know, that if someone is thinking about their own death a lot, or just death in general, that is a symptom of depression as well. And what I mentioned before, some people get, number 12, get unexplained symptoms of physical illness, for example, like a headache that won't go away or back pain. And they've been to umpteen million doctors and there's no physical basis for this problem. A lot of times it can be depression that is manifesting itself in a physical problem that does not have a physical root to it. So those are 12 different symptoms. And you don't have to have all of them to be considered depressed. And, you know, there's no hard and fast rule about how many you have to have. We all get blue on occasion. If something happens in our lives, it's very disruptive, or if we should lose a loved one or have a new illness, it takes time to get over these losses. And feeling down is a normal reaction. Depression does not work that way. It doesn't give up and it doesn't go away. Typically, depression will, in order to be classified as a clinical depression, you have to have these symptoms for like a 2-week period. All right. And then too, that it really interferes with your life. You can't make yourself do the things that you need to do, and you can't take care of yourself because you're going through this. So those are all the symptoms of depression, and something that all of us need to be tuned into. Like I said, some of us may have some of them, but not all of them. But if you find that over time that you are experiencing some of these things, and I think that's a red flag where, you know, you ought to start thinking about doing something, getting some help for these issues. The other psychological problem that I want to review in more detail today is anxiety disorders. Because some people, instead of, you know, responding to being isolated and quarantined and the fear of the pandemic, instead of getting depressed, they might get very, very anxious and worry about their own risks, worry about the, you know, the impact on their family and loved ones. And people can develop anxiety disorders. So I want to review for you some of the symptoms of anxiety and panic disorders right now. So number 1, feeling nervous, restless, tense. And I'm not talking about just once in a while. I'm talking about in general. All right. That's the way you feel most days. If you have increased worry about your health, apprehension and fear about the pandemic, if you're worried about catching the virus yourself or about your family or friends catching the virus, having a sense of impending danger or doom, that worried about, you know, losing a loved one. And I guess not being able to stop worrying along these ways, no matter how you try to talk to yourself and ease your concerns. Number 5, feeling weak or tired most of the time. That can be a complication from chronic anxiety. You know how exhausting it is to worry at different times. If you're doing it all the time, you can imagine how tired you are. Number 5, trouble concentrating, a difficulty of thinking about anything but the present worry. So say you have this fear about your loved ones getting the virus. I mean, I think we all have that fear, right? But with someone with an anxiety disorder, they can't move from that anxious thought, okay, and distract themselves and go do something else. It always interferes and comes back, you know, to the forefront of their thinking. So it's hard to switch tracks when you're really, really anxious. Someone with an anxiety disorder could have a disruption in sleep. They could have trouble falling asleep at nighttime, problems with insomnia, and problems with restlessness. People with anxiety disorders often have increased gastrointestinal problems where they can't get off the toilet. You know, a lot of people who suffer from irritable bowel disorder, for example, well, that's a stress-related disorder. So the more stress you feel in your life, the more symptoms that you might have. Increased heart rate is a symptom of an anxiety disorder and a panic disorder. And as well as breathing in a rapid and shallow way, like kind of panting like a dog would breathe. That's a symptom of being anxious. Also, excessive sweating and shortness of breath. Now, sometimes when people have panic, it can cause a particular concern because some of the symptoms of panic could mimic some symptoms of COVID. All right. So that if you have like shortness of breath and racing heart, and that you're really having a panic attack, some people might think, oh my God, I must have COVID, because that can be a symptom of COVID as well. So, but that's where it's good to talk to yourself and say, oh, I'm just feeling panic. This is not COVID, you know, to reassure yourself. So the rest of the time today, we're going to talk about what kind of strategies seniors and people of any age really can use to arm themselves and to protect themselves against developing depression or against developing anxiety as a result of all these restrictions from COVID. All right. So we're going to explore a number of different strategies that are really, really important. And the number one is establish a structure and a routine in your daily life. Consistency and predictability are important hallmarks for maintaining a sense of control and well-being. People might think, oh, you know, I'm home with COVID all day. What do I need a day planner for? But actually, now's when we need a day planner, because we don't have the structure of, you know, having to run here, run there, run everywhere. We have to plan our day, and we can use a day planner to do that. And I'm talking about planning simple things like what time you wake up in the morning and what time you go to bed at night. What time will you have your meals? When will you do a little bit of work around your house? When will you make your social calls? And when will you watch the news? These are all things that we all do during the day, but you could plan it so that you have an idea of how your day is going to unfold. All right. There's a lot of solitary activities that we all take part in now, like board games or word games, solitaire, jigsaw puzzles, reading, listening to music. All of those things can be programmed into your day too, where you say, oh, you know, from 2 to 4, that's when I, you know, put my feet up and read my book and listen to my classical music. So it's planning, having an idea of how your day is going to unfold. Number 2, remain cognitively intact. And this is for people with dementia, without dementia, because if you are blessed with not having any signs of dementia at this point, you want it to stay that way. So you want to stay as cognitively active as you can be right now to keep any kind of memory loss at bay. And if you already have a little bit of dementia, it's important to be cognitively active so that you can keep it from your dementia from getting worse. All right. So it's all very important. Number 3, seek out moments of pleasure, meaning, and mastery. I listed a lot of things already of different things that people like to do. And we've each got to figure out what things bring us joy, what brings us pleasure, what gives us a feeling of mastery. Like when you get it done, you think, wow, that's pretty amazing that I can do that, and it's important to have those moments. So, and we got to program them into our day. Very, very important is maintaining social connectiveness with our family and friends. And we don't have to be some computer whiz to be able to do it. There's a lot of ways of staying in touch with our loved ones and our acquaintances. And it's as simple as picking up the telephone, even if you don't have a smartphone where you can use FaceTime to see people when you're talking to them. But if you are technically savvy a little bit and you can use FaceTime and see the person when you're talking to them on the phone, that certainly adds a whole nother dimension, and it makes you feel more connected. If you can do that, I would encourage you to try it, certainly. Or if you can take part in these Zoom classes, just like we're doing today. It puts you in touch with people, and it makes you feel less alone. There was a study in Indiana that showed that 60% of seniors were spending more time reconnecting with people on the telephone and with people that they cared about. And many using internet technology to stay in touch, but you don't have to, because like I said, the basic telephone works just as well. So in this study, seniors reported spending an average of 76 minutes a day on the telephone. And that seems pretty reasonable to me, but I think that's a good amount of time to talk on the telephone. I think if you have people who are interested in having conversations and will spend that amount of time on the phone, then go for it. There are other friendship lines as well that are available. If you don't have someone that you could pick up the phone and call when you were feeling lonely, the AARP has a friendly voice line that you can call just to have a conversation with somebody. And the Aging Institute also has a friendship line. And at the end of our presentation today, I have those numbers for you. So another important thing for strategy for promoting good mental health is get regular exercise. Go outside daily, weather permitting, but just follow the social distancing rules for staying safe. Just a 20-minute walk outside every day can really reduce your stress level and enhance your feelings of well-being. You start walking or doing other exercise, then that gets those endorphins going, and it really can reduce the stress level quite beautifully. And there's other kinds of ways you can exercise. Say it's raining outside and you don't want to walk outside. You could do just simple stretching in your home. You could do exercises in your home. You could take part like in the yoga class that Michelle had earlier today on their service. So there's all kinds of classes that are available online too. Number 6, maintain a healthy diet. So very, very important. Eating plenty of fruits and vegetables, whole grains, lean proteins, and to drink plenty of fluids, because as seniors, we all are at risk, I think, of getting dehydrated and not getting enough fluids into our body. And that's a pretty easy way to get ourselves sick. So it's important to drink lots and lots of fluids and to limit processed foods and limit sugars and high fat foods. So having as healthy a diet as you can is going to give you more energy, just make you feel better about yourself. Try to find ways during your day of, incorporating relaxation into your day. If you need a nap, take a nap, but take a short nap and have it early in the afternoon, late morning or early in the afternoon, so it doesn't interfere with your sleep at nighttime. Also, there are mindfulness classes that people can take online. There's meditation classes. There are deep breathing exercises people can do to just try to get themselves to relax every day. There are different apps that are on your cell phone, like Headspace, that could take you through meditation courses. And it's all for helping you just to get to that place of calm inside of you. Sleeping well is very important. We mentioned that before, having a regular sleep schedule and a sleep location too. Like, I would encourage always sleeping in your bed and not getting into a habit of like sleeping on your couch some nights sleeping in your bed. Because our bedroom is meant for sleeping, and it has a way of, encouraging sleeping behavior. So manage or stop alcohol use. Okay. So first of all, many people, when they are quarantined at home and are bored and don't know what to do with themselves, and they might drink to comfort themselves or to make them feel better, but it's a dangerous behavior, because as a senior, you are putting yourself at risk for more falls. And oftentimes the alcohol does not really, work well with different medications that you're on. And an important thing is that alcohol is a depressant. All right. So it can make people down in the dumps if you drink. So it can contribute to depression instead of actually making you feel better in the short run. All right, number 10, limiting exposure to news and social media coverage. This is very, very important. Some people will watch the news all day long and feel like they just have a constant need to be updated as to, what the current statistics are. And it could be a dangerous thing because, as you know, the news is sensationalistic and they're alarmists, and they're trying to get you to tune in and to not walk away from the television. So they have to keep your attention, and they do that by kind of trying to scare us in certain ways. And I believe in science. I believe that we should keep up with, all the new updates, but I think we should limit the amount of time that we do engage in those updates, instead of having the news on around the clock that can only serve to frighten you and alarm you. Maybe once or twice a day to check reputable sources of information, like the CDC or the World Health Organization, to find out what their new updates are, or what they're recommending. And again, to limit that to once or twice a day. So if you find that during COVID that you are feeling depressed and that you can't shake it, and that even with trying all of these different things that we have talked about to promote good mental health, that you still need help, get professional help. It's there, it's available. And even during times of COVID, it is available. My practice is completely remote at this point in time. And I know that many, many therapists are working remotely. There are a number of different approaches to working with depression and anxiety that could be very helpful to people at this point. And one is cognitive behavioral therapy, where a therapist would really help you identify what the negative behaviors and the negative thought patterns are that are contributing to you feeling depressed or anxious, and to help you change those things. Mindfulness is very important in terms of teaching you to to live in the present and to not, focus on the past and all the problems that you had in the past, or to fear the future, but rather to remain in the present. A couple of other things is that before I go to affording therapy, I just wanted to add, if you have a faith, tap into your faith. All right. And if you're struggling and you need help, practice prayer, ask for strength and guidance, speak with your clergy, your priest, or your rabbi, and get support. And practice gratitude is another really important thing that I think can really help us cope with what we're going through right now, to be grateful to be alive, and even though it's not easy to be alive right now, but to be grateful to be alive. If you decide that you need a psychotherapist, I want all the seniors to understand that it is affordable. Many seniors might think that they can't afford psychological therapy, but that's not true. All right, that if you have traditional Medicare or Medicare Advantage plan, there is coverage for mental health services through your Medicare. Mental health services are covered through Medicare, traditional and managed Medicare, at the same rate that they're covered as they cover primary care. All right, so usually and also I'm a Medicare provider, and most people are who work with the Medicare system. And that means that Medicare sets the rate, says, you want to see a therapist? Then, okay, here's what we pay for it. This person accepts assignment. You could see this provider, and we'll pay 80% of it, and then we'll send it to your secondary provider. So it works just like any other charge that any of your doctors might submit to Medicare. So there are, you could be, and Medicare doesn't even approve it. It's your decision. If you want to talk to a therapist, if you feel that you could enjoy extra support and some guidance during this time, then you, as a senior consumer of Medicare services, makes that decision that you want to talk to a therapist. All right. And then your therapist will submit your claim to Medicare. But many cases as well, Medicare is waiving the copay for people. First of all, Medicare doesn't have a copay for mental health services, but your secondary insurance will waive a copay. Or if you have a managed Medicare program, they are waiving copays right now. So because they want seniors to get assistance. All right. So there's no reason not to. Look at, here we are. We had a nice conversation today, all in the comfort of our warm, toasty homes and not having to go out in the snowstorm. And mental health therapy is available to you that same way. And I just want you to understand that it is not a sign of weakness to get help for depression or anxiety. It's actually a sign of strength, because you're struggling a little bit, and get some help so that you can be stronger and that you can learn better coping skills. And if you feel really socially isolated, talking to a therapist once a week is another way to connect on a social level with someone, and having that be a routine social contact for you. So I think that's pretty much it. I did put together some information about my own practice. I am accepting new clients right now. I have my office phone up there, my cell phone as well. If you felt like you would like to talk to a therapist, but maybe someone different than myself, I have the number for the New Jersey Psychological Association there, which is their referral system. And you just call them and tell them where you live and what kind of insurance you have, and they will set you up with a therapist. There are also numbers on there for AARP and the Institute for Aging friendship lines. So if you have any questions, I guess now's the time to ask them.
That was great. Great, Victoria. Really great. Does anybody have, if you want to put a question in the chat, you can do that now. If you want to unmute yourself and just ask the question, you can certainly do that as well.
I have a question. This is Sharon. Can you put that back up on the screen? I wanted to screenshot it.
Sure.
Yeah.
That's a good idea.
Yep. Sure.
Thanks.
Yep. Is that okay?
Not yet.
Not yet.
Okay.
There it goes.
You have it?
Got it. Thank you.
Okay. Does anybody else have a question for Victoria, or a comment, or anything else?
I have a question for Victoria. I deal with a lot of Hispanic patients who have a preference for speaking a Spanish-speaking therapist. Do you have any? I can speak to you offline. Are there clinicians available who could treat that population?
Well, I think that's one way that you could use the referral system with the New Jersey Psychological Association. Tell them, let them filter for that. Tell them that you need a Spanish speaking therapist, and then they can filter out, find people that do speak that language.
Great. Thank you.
But that's a good question.
I think it's also important for people to just realize and recognize that this, I shared my 9/11 story with people, and that happened, almost 20 years ago. And, I felt the effects, the post-traumatic stress, disorder effects of that for years and years later. Like, and in a way, the trauma didn't really present itself for many years. Because
that can often happen, right?
The delayed reaction. And I think, but that was one day of like serious trauma that had sort of a delayed reaction in the symptoms that presented themselves. But I think for a lot of people don't realize that this time is just this extended time, especially for healthcare workers. I just can't even day to day. But as just people living in the world with this, and we're all doing this together. Everybody on every, I think they just discovered this, remote island. I mean, COVID just came to a remote island, but it's everywhere. There's no way of escaping it. In some ways it's comforting to know that we're all in this together, really. And then another way, it's scary because there's nowhere to escape it. So, but I think that collectively, I think if we repress our feelings of anxiety, we sort of run the risk of having them pop up later. Like we have to realize that this is, we may be making lemonade, but there's a lot of feelings around this.
Right. And it's so important to be able to share those feelings and to talk to somebody about it, because that's an interesting comparison, Michelle, you made between 9/11 and this pandemic, because like you said, 9/11 was one day, but still, the effects lasted for so long. But two, the effects of chronic stress over time, months and months and months that we're experiencing with this pandemic without any true understanding of when there might be an end date, and I think it's the chronic nature with an indefinite ending, that kind of, really ups the ante in terms of being more difficult for people.
Sure, absolutely. Well, thank you so much. Does anybody else have any questions? All right.
Thank you for joining us.
Thank you, Victoria.
Very good.